Lesson 2, CDS, Introduction to Medication Support, Medication Basics. After completing this lesson, you will increase your understanding about getting the prescription filled, multiple locations, effects, interactions. Getting the prescription filled. Your agency shall establish procedures to ensure that medications are picked up, delivered, and administered within 24 hours unless otherwise documented by the prescribing person. When medication will be administered at more than one location. Residential programs. If the person has medication that needs to be administered both at home and at day program, you must A. Get or make a second copy of the signed order from the prescribing person for the day program. B. Calculate how much medication is needed in each location. C. Tell the pharmacist that you need a separately labeled container for each location and explain how much needs to be in each container. D. Check with your agency on how the medication must be transported to and from the day program. If the person has medication that will be needed while away from home, e.g., visiting friends and family, movies, shopping, or at work, etc., the standards for community residences for individuals with developmental disabilities, NJAC 1044A, states that, quote, all medications shall be kept in their original containers from the pharmacy and shall be properly identified with the pharmacist's label, end quote. When medication will be administered at more than one location. Day programs. If medication must be administered while someone is at your program, you must have A. A copy of the signed order from the prescriber with the word copy written or stamped on it. B. The medication in the original container issued by the pharmacy and it must be properly labeled. C. A record of the receipt of the medication, including the date received and the number of pills indicated on the bottle. If medication comes in another form, e.g., creams, liquids, etc., the amount received must be documented. D. Your agency might have a policy to count the pills. Check with your agency for specifics. According to the standards for adult day programs, if you are going to be away from the program when a medication is due, then the medication must be in a sealed container labeled with the following: 1. Individual's name. 2. Name of medication. 3. Dosage. 4. Frequency. 5. Time of administration. 6. Method of administration. Pharmacist gets prescription. Once a medication is prescribed, you will need to make sure the written prescription gets to the pharmacy. A prescription functions as a signed order from the physician to the pharmacist. A sample prescription is shown below. Prescription explanation. 1. The phone number, name of prescribing person, and address. The information must appear on the prescription. 2. The batch, license, and DEA numbers are numbers verifying that the person has the authorization to prescribe. 3. Name of the person for whom the medication is prescribed. This must match with other medications and the existing medication sheet. Date of birth and address are typically not written by the doctor, but are used as verification by the pharmacist. The date must also be included on every prescription. 4. Rx is a formulation from a Latin word meaning take thou. It is followed by the name and strength of the prescribed medication. In this case, the name of the drug is Lipitor and the strength is 10 mg or milligrams. 5. SIG is an abbreviation of the Latin word meaning write on label. TAB is tablet. The daily dosage is sometimes written in Latin numerals and abbreviations. T with the dot over it means 1, and QD means once daily. Your agency may require that specific administration times be indicated on the original prescription. The pharmacy will translate, and staff are not required to memorize these abbreviations. However, direct care staff have caught pharmacy errors by referring to the abbreviation list and comparing the pharmacy label to the original prescription. 6. Dispense specifies the number of units or count of medication the pharmacist is to provide. 7. The prescriber must indicate whether or not substitutions are permissible. If the prescriber indicates no substitution for a brand name medication, he or she must indicate brand name medically necessary so that Medicaid will pay for the medication. If the prescriber permits substitution, the pharmacist may give you a generic brand, e.g. phenytoin, instead of a brand name, e.g. Dilantin. The generic medication will be the same thing chemically as the brand name medication and is very likely to be less expensive. Ask the pharmacist to verify that a particular generic drug is exactly the same thing as the brand name prescribed by the physician. Ask the pharmacist to include both the brand name and generic name on the pharmacy label. If the medication is generic, the pharmacy may type generic for or S/F, which can mean substituted for or same formula as. 8. Refill. Tells how many times a medication may be reordered without obtaining another prescription. 9. The prescriber's signature. The doctor or advanced practice nurse must sign each prescription. Medication packaging. 1. Medication can be packaged in many other ways besides in a bottle. Some of the other packaging includes A. Bubble packs, 1 month on each card, or can be weekly cards. B. Cassettes, often 2 weeks in each cassette labeled Monday, Tuesday, Wednesday, etc. C. Rolls or spools. Each tablet or capsule is fully labeled and can be removed one at a time. D. Bags. Tablets or capsules due at a particular time in one sealed clear bag that is labeled. 2. The pharmacy label on the package may be arranged differently, but the information required remains the same as a pharmacy label on a pharmacy bottle. 3. Check your agency's policy regarding documenting the amount of medication received. Pharmacy label. The pharmacist will give the medication in a container which has a pharmacy label. The pharmacy label must match the prescription exactly. The pharmacist cannot add instructions to the typed label. No one can write on the pharmacy label or medication container or medication packaging. The pharmacist might add additional information on stickers on the pharmacy container, such as drink with milk, may cause drowsiness, etc. If the new information is in conflict with the person's schedule, contact the prescriber immediately. The label shown below is an example of a pharmacy label made from the prescription looked at previously. Label explanation. 1. Pharmacy's name, phone number, and address. 2. The individual's name and address. 3. Date the prescription was filled. 4. Name and strength of the medication. The name and strength may not match the prescription if substitutions, e.g. generic for brand name, are permissible. It is a good idea to have both the brand and generic names on the label. In fact, some agencies require it. 5. Dispense number. 6. Directions for taking the medication. 7. Prescription number given by the pharmacy and the physician's name. 8. Number of times a medication may be reordered without a new prescription. 9. Medication's expiration date should appear on the pharmacy label. It is unsafe to take some medications after a certain period of time. The expiration date for prescribed medication must be 1 year or less from the date on the pharmacy label. Checking for mistakes. Although pharmacy labels may look different, all of the information must be on the label. Check and double check. When you are at the pharmacy, immediately compare the pharmacy label with the copy of the signed order, e.g. prescription copy, e-script, etc. If there is any mistake, show it to the pharmacist and ask for the pharmacist's help in making these two pieces of information match. If you do not pick up the prescription at the pharmacy, make this comparison at the time it is delivered to you. If you find a mistake, contact your supervisor immediately. You cannot document on a medication sheet or administer the medication until the mistake is corrected. Check your agency's policy regarding counting medications. If your agency's policy requires checking the amount of medication received, you must let the pharmacist know if the amount is incorrect. Sometimes medication is prescribed over the telephone. When you get the medication, look for mistakes by comparing it with the verbal order and then with the signed order once it is received. Please compare the copy of the prescription and the pharmacy label for Sally Smith on the next page. Please look for mistakes. The mistakes in example 1 relate to the medication information. Please compare the copy of the prescription and the pharmacy label for John Jones on the next page. Please look for mistakes. The mistakes in example 2 include the person's name, the person's address, and the medication information. Please compare the copy of the prescription and the pharmacy label for Kathy Green on the next page. Please look for mistakes. The mistakes found in example 3 include the person's address and the medication information. Advocacy. Consider Kathy's preferences, her work and home schedules. Look for other options for Kathy. Contact Kathy's prescriber to advocate for changes as needed. Advocacy. 1. If all the additional instructions for Kathy were correct, third label from prior activity, then this medication would be very difficult for staff to administer and Kathy to take. A. Were her preferences and work and home schedule considered? B. Will she be able to avoid food or milk in the time frames described, or will this be too difficult for Kathy? C. Will this completely disrupt Kathy's normal routine and cause her stress? 2. As an advocate for Kathy, we should be looking for other options for her. There may be another medication that would work for her but would not have so many restrictions. 3. If this medication is the only one that will work for Kathy, at least she will see that we work together with her to try for another option. This may be helpful in the difficult days ahead as she tries to manage this medication within her schedule of work, meal times, snack times, etc. Effects of medication. Whenever a prescriber prescribes a medication, he or she must weigh the potential benefits of the desired effect and the potential dangers. Only physicians and/or advanced practice nurses may prescribe medications. Only registered pharmacists may dispense medications. Only trained staff may administer medications. Desired effect. The desired effect is the beneficial effect of the medication. The medication is doing what it was prescribed to do. Examples of desired effect include seizure activity being reduced by an anticonvulsant, Dilantin, a headache stopped by a pain reliever, aspirin, or preventing an illness, rubella, H1N1, chickenpox, with a vaccine. No effect. No effect means an absence of any effect. The medication is producing no change. If the response time has been reached and no benefit has been seen, there is no effect. For example, an infection does not improve or may get worse even though an antibiotic was taken, or seizure activity is not reduced or controlled by an anticonvulsant. Unwanted effects. Unwanted effects are the effects that are produced by the medication other than the desired ones. They can be relatively harmless, e.g., drowsiness, urine discoloration, etc., harmful, e.g., rash, vomiting, etc., or life-threatening, e.g., difficulty breathing, etc. The staff are responsible for reporting any changes. Even if the unwanted effects are expected, it is necessary to observe and report these effects. This could be to the prescribing person, agency personnel, administrative staff, agency nurses, etc., and or others as directed by your agency. The most important thing to remember is that any change, physical or behavioral, especially during the first few days when a new medication is introduced, may have been caused by that medication. As a staff person, you are best able to observe for any behavioral or physical changes. In fact, it is up to you to observe and report any and all suspected effects of the medication immediately. Medication interactions. Whenever one person is taking two or more medications, an interaction is possible. Every medication has the potential to interact with another medication. Medication interactions are the result of taking two or more medications at the same time. The resulting interaction may increase the effects of one or more medications. For example, if someone is taking fluvoxamine, brand name Luvox, and then is prescribed diazepam, brand name Valium, the effects of the diazepam will last much longer. Decrease the effects of one or more medications. For example, if someone is taking esomeprazole, brand name Nexium, and then is prescribed iron chews, the iron will not be absorbed into the body properly. Create new and unique unwanted effects. For example, if someone is taking phenytoin, brand name Dilantin, and then is prescribed omeprazole, brand name Prilosec, it can cause toxicity resulting in symptoms such as drowsiness, seizure, and nausea. There are important points to remember concerning interactions. 1. The greater the number of medications taken at one time, the greater the possibility that a medication interaction will occur. 2. It is important that each prescribing person is made aware of all medications a person is taking to avoid unwanted medication interactions. 3. There may also be food and beverage interactions. Some medications require that certain foods and beverages be avoided, while others require that specific food or beverages be consumed with the medication. One example would be to avoid foods high in acid when taking antibiotics because antibiotics are destroyed by stomach acid. Another would be to increase foods high in acid, e.g. orange juice, when taking urinary antiseptics, as these medications work best when the body has a high acid content. In addition, many medications specify that you shouldn't drink alcohol while taking them. 4. Sometimes there are environmental interactions. Some medications, antibiotics, cardiac, diabetic, and psychiatric, can cause an individual to be very sensitive to sunlight, which can cause a quick and serious sunburn. Other medications, blood pressure, arthritis, and skin, will increase the likelihood that individuals will be cold. You must be aware of the potential interactions of the medication the person is taking and take precautions to prevent harm. In addition to medication effects previously described, there are additional terms to be familiar with when discussing medication effects. Medication allergy. An adverse reaction to a medication, e.g. antibiotic, etc., that is mediated by the body's immune system. The response may be immediate or slow to appear and can become life-threatening. The following are serious signs of allergic reactions that can be life-threatening and require calling 911. Trouble breathing, including wheezing, shortness of breath, tightening of throat, swelling of face or tongue, rash, hives covering face or large portions of body, dizziness, lightheadedness, or loss of consciousness. Cumulation. The body does not eliminate one dose of a medication before another dose is given. Tolerance. Resistance to the effect of a medication. Addictive effect. The physical or emotional dependence on certain medications. Toxicity. When medication levels are dangerous and or poisonous to the body. Medication elimination. The effects of a medication cease when the medicine has been eliminated from the body. Medications are eliminated by the lungs, kidneys, intestines, skin, liver, or salivary glands. However, bear in mind that many medications build up in the body, and when the medication is stopped, the effects may continue for several days until it is completely eliminated from the body. Medication sensitivity. An unusual reaction to a medication that does not involve the immune system and is typically less severe, such as drowsiness from a medication that typically does not cause that reaction. Medication information. Your agency is required to provide you access to a medication reference written for the layperson. The reference must be current within 3 years and include information on the effects and interactions of medications. The Pill Book is one of several medication information manuals that will help you get this information. This manual will list the medication by both the generic name and brand name, as well as describe important information about each medication. If a prescribed medication is not listed, you should call the prescriber or a pharmacist to get the information. You can also get a lot of information on the internet, e.g. WebMD, Yahoo Drug Guide, etc.